I mean, these headlines look, a bit concerning at first value. Should we be worried?
I don't think we should be worried, Ian, at the moment. Obviously, the headlines are concerning, but most of the pandemic, the newspapers' headlines have been more concerning. They tend to focus more on the negative stuff. Let's break down what's actually happening at the moment then.
Yeah.
So, we have started seeing a rise in cases. Now, if you start looking underneath kind of the headline numbers, what that is generally older people. So that is a little bit of a cause for concern. So you're talking kind of people over the age of 50, younger people, the positive tests are kind of falling. But remember, in January, they changed the testing regime a little bit, so fewer people are going forward.
Yeah.
I wouldn't say this is predominantly all down to kind of Boris getting rid of all restrictions, because we've seen cases going up in Scotland as well. And obviously Nicola Sturgeon hasn't gone as far as Boris Johnson yet. So I don't think you can say Boris getting rid of everything, self-isolation is the cause of all of this. I think probably what we've seen, Ian, is that we know that the vaccines don't stop you catching COVID, but they do stop you they reduce the risk of you catching it, in particular if you've just had the vaccine and looking over like 4 to 5 weeks afterwards. And the older age groups that we've seen the rise in cases and the rise in hospital admissions are those who had the booster first. So they've got the 4th dose of the vaccine coming out soon. I think it does raise into some question how long these vaccines last. It did say around 10 weeks.
Yeah.
Maybe we do need some new types of technology with these vaccines, because you can't keep vaccinating every 3 months. But the important thing is, if we start focusing on some of the death figures, the numbers you quoted there are deaths within 28 days of a positive test. If we look at the ONS figures and the total number of deaths for any reason, they are still at the moment below what we saw pre-pandemic. So I'd say don't rush into too much caution with that.
Well, I was going to say on that point, Jamie, firstly, that's absolutely correct, isn't it? That the death figures, it always sounds very crass talking in these terms, but that's how it is. The death figures are below what you would expect on a rolling average anyway. But even if we didn't have COVID, then flu numbers that we would normally have at this time of year would also be factored into this, right?
No, indeed. And if you look at the facts and figures, we've seen very little flu at all in the last 2 winters. It's kind of like COVID's miraculously eradicated the flu overall.
Yes.
But you're right there. Remember now that the figures at the moment, they will be affected, Ian, because it is a bit crass, I suppose, talking about death figures, but people can't die twice either. And we did see a large number of excess deaths in March and April when the first wave hit us, and then last winter we did as well. So there may be some people who have died there who may be dying now, which means the numbers are slightly low. But we're not seeing this big excess. The thing to keep an eye out for over the next few weeks, obviously, is going to be if these older people who are in hospital with COVID, if they sadly succumb to the virus. But let's just highlight a couple of other key facts and figures that have changed since Omicron, Ian, is that only about 40% of the patients in critical care with COVID, because obviously we test everybody, are actually in predominantly because of it. They might have just gone in for some other reason and they tested positive. And with COVID being so much more prevalent across society, you get that similar thing in general beds as well. So we'll get a bit of a better picture. And the number of figures, because remember, I think I spoke to you about this before, the number of patients in critical care who are unvaccinated, because that seemed to be a big thing over the winter. It was talking about vaccination status. When we had the December figures, they overrepresent themselves in terms of the population. It was over 60%, but that's fallen back to about 45% in the January figures.
Interesting.
And remember, much fewer people in hospital as well.
Absolutely. Jamie, it's always thorough stuff. Thank you for your time. Jamie Jenkins is the former head of health analysis at the Office for National Statistics. You need people like Jamie to crunch the numbers, and I think more than anything, contextualise the numbers. That's the important thing. You can see some people salivating when they see an increase. Seriously, look, this is Boris Johnson's fault. And as Jamie said, well, you've got a similar pattern in Scotland, in Wales, where they haven't gone to the same extent of lifting all restrictions there. So what would that tell us? And of course, we know that in France, where we've had, I'm not sure what the numbers have been in the last couple of weeks, but up till recently, huge numbers in France, despite mask mandates and all manner of other measures in place as well.